Hi there. Welcome to my other's keeper.
Hey,
Surprise! It's not Pamela. It's Krystal. Pamela, she ended up
I need
not
to
being
I
well
need to
today.
figure out where to
Point the
lay.
opposite direction to where you think you need to be. So
Well,
if you
if
think,
if I have my hand like that, it's not quite in the. So I have
right,
to
yeah,
go over
always
a bit
have it like
further.
right in front of your shoulder or in front of your face. It just feels weird to normally
Yeah.
be gesturing out here and then having to gesture in here. And yeah. Hi, Patches. That's Crystal's
Yes.
other baby that we don't get to see as much, Patches.
She has become quite connected to me these last few weeks.
Nice.
So
That's
yeah, it's,
wonderful. Oh, that's good.
and then she bites.
Okay.
Oh
Sort of like
well.
Tommy and Moose. Yeah. You don't follow the lifeboat. So the
No, I
leader,
don't.
the admiral of the lifeboat, his name is Tommy. And he and Reese have a cat named Moose. And Moose was a barn cat, a farm cat that they brought into the house at about, I don't know, 8 or 9 weeks old. So really little.
Hmm.
And he has acclimated to living in the house admirably. He didn't keep all of his feral ways, which was kind of, you
Oh
know.
no.
Uh, but oh, hey, Mary, nice to see you.
Hey, Mary.
Um, and so yeah, Moose is in the house, and Moose is super affectionate, much like your cats are super affectionate. But Moose will be affectionate and then bite you. But it's a love bite. It's a nibble. It's not a and that's he's a baby cat. Oh, hey Brian, how
Hi,
you
Brian.
doing? Awesome. Nice to see you guys.
Well,
Um,
Patches was a farm cat, and I got her
was
when
she?
she was about 8 or 9 weeks. We're actually not completely sure how old she was, but we
Mm,
figure about 8 or 9 weeks.
okay. Okay. So
Leo's
still
mom
really
was
little.
a Leo's mom was kind of an outdoor cat too, but at a um, bee farm.
Mm, cool. Oh,
So
Sandy Wandy.
hi,
Hey, nice
Sandy.
to see you. I'm glad everybody's here so far.
Yeah.
So Brian, what it be a day? Tell me what a day it be. Besides it be Tuesday. So
It sounds like it's been a day for everybody.
it has. My day has been absolutely uh, busy. My mama, that you all met when we were talking about marriage a couple of weeks ago, she is here visiting me. Yay! And no, she won't be online again. That was kind of one of those once in a blue moon sort of situations that I asked her, and it took her a long time to think about it. And I'm really grateful that she decided to do it because, frankly, talking about marriage, I think for me, she is the perfect person to talk to because she's the person I learned about being a wife from, and everything from being a wife to somebody who was awful to being a wife to two men now who are absolutely wonderful. It's been
Okay,
really
take care.
great to watch. So, yeah. Um, let's see. So it's a loaded question at the moment, is it, Brian? I am so sorry to hear that. Okay. Um, Anyway, tonight we are going to talk to Krystal about the beginning of her healing journey. And so we've all heard about all sorts of things that have been absolutely horrific. And there has been a long journey since leaving all of that behind. It's been years, but she still is in the middle. Sometimes she feels like she's at the beginning of healing. Sometimes she feels like she's really healed. And then most of the time it's kind of like there's a tenuous grasp. But honestly, for the last, how many months have we been reconnected? Like since February?
um, well, you ended up reaching out. I think it was in about October of last year, because
Oh,
just
was it
after
almost
I
a
had
year
my
ago?
last, Yeah, because the first time we
Oh.
kind of connected was just after I had had my last surgery,
Ah,
which was
okay.
last October.
Okay. Awesome. All right. So it has been almost a year. It's almost happy anniversary for us. Um, woohoo! Uh, so, well, that's cool. Yeah, we kind of got in touch and then we both backed off because neither of us were really sure how the other would react, knowing that we had
Yeah,
such a similar history, right? We were both a little
yeah.
nervous about that. So once we finally really reconnected,
Mhm.
it was still winter, wasn't it?
Yeah, I think it was, I can't remember exactly when it was, but I think it was probably in like December or January, somewhere in there.
It would
I
have been
was just,
after Christmas.
okay, so in January. I was
Yeah,
having a really, really tough time, and I put it out on Facebook that
right.
really struggling, and you reached out, and I you messaged me, and I quickly responded, at work right now, but I'll talk
Don't
to you
talk to
when I get
me.
home.
Yeah, yeah,
I Because of my mental illnesses, my job has been really good with me. Um, they know that anytime through the day, well, not only do I use my phone to get in contact with managers, I also have the ability that if I need to, I can connect with any of my supports as well,
absolutely. Yeah.
just to be able to keep myself half sane.
Well, sane is a highly subjective word.
Yeah, I guess.
Who really wants to be that sane? I know I don't. I just, you know. Uh, but anyway, so when you are talking about your healing journey, um, it always starts with a diagnosis. Like there's the pain, then there's the diagnosis, and then there's the surgery or whatever it is that um, that helps to get rid of it. And it's that healing process can hurt on its own, but
Yeah,
man, it's so essential, and it is so important to get it done right. So,
yeah.
hey, Indigo. Um,
And I go, so probably a couple years after moving to the community I'm in now,
mhm,
I had been working with this in treatment facility. And at one point, they asked me, they said to be able to better help me, I needed to go and get a diagnosis from a psychiatrist.
mm, okay,
Um, I was petrified to go to see a psychiatrist for a couple of reasons. I grew up, and I mean, absolutely no disrespect, but this is the way I knew as I grew up. I I had an aunt, one of my dad's sisters, that I never met,
right.
but I was always told stories about her.
Mhm.
And she was an absolute card. I would have loved to have met her. She just sounded like an amazing person. But she liked to, like, as she was growing up, she was retarded.
That's the
And
word that was used.
yes, I don't say that in a bad term. It's just that's what I learned growing up.
Right.
Hi, Crystal Phoenix.
Hi, Phoenix.
Um, so I was told the stories about how when company would come over, she would take a one of her responsibilities was not just leave me alone. One of her responsibilities was to help clear the table and put things like clear things off the tables when especially when company was there.
Mm-hmm.
And she had this really cool sense of humor where she would take the teacups and she would put the teacups just off center of the saucer and then sit
Okay.
there and shake. And of course everyone's like, ah, she's gonna drop it, she's gonna drop it.
Meanwhile, she had perfect control.
Yeah.
Oh, that's awesome.
One of my other favorite stories of her was she would take flies. She would grab them by a wing. She'd pull the
Mm-hmm.
wings off and then put them back down on the windowsill and
That's
watch
terrible.
them
Like, I personally find that terrible. I think that's awful. You think it's hilarious. I think it's awful.
The
It's
thing
like,
is, you got to remember, this was like the 30s, 40s,
yeah, that's
somewhere
true.
in there.
Yeah,
So,
yes.
but
Indigo
um,
has a good point here. It must have been hard growing up during that time with the diagnosis, though. She sounds like a genuine lady. Yeah,
yeah, she
absolutely.
sounded very nice.
Yeah.
I never ended up meeting her because by the time I came around, she was in a long-term care facility,
Mm.
and she was also in a community that was more than an hour away. And so
Mm-hmm.
that just was an absolute, that's not going to happen,
That's
according to my mother.
well, no, when we were kids, though, an hour away was a long way, and now an hour is like, I can do that. I can do that and come home in an afternoon. It's just so much more
We go,
doable now.
we go, and there, when I was at Bible school, we would go an hour just to have coffee.
Exactly. Exactly. When I was in high school, we would go from the town where I lived and then about 45 minutes away to the only 7-Eleven around. And then we would come home and have our Slurpees. I mean, that's what we did. We call it a Sev run, and it just happened to be in a different town a long way away where we could drive really fast on the back roads. So a
That's
lot of fun.
that's what the guy at Bible school always said.
Hmm.
7-Eleven run, because
Yeah, Sev run.
that's
Yep.
where we got the crispy chicken.
Yeah. Yep.
And he had to have that every day.
Oh, wow.
But not only had I grown up knowing about this aunt,
Hmm.
I will use the names on these two because they have passed.
Okay.
Her name was Aunt Lillian,
Hmm.
and another aunt that I grew up with that, and now both of these aunts, my mom used to compare me to, and especially this other aunt who I absolutely loved. And I actually have a picture of us probably at the about the same age. Actually, no, she was probably in her late 30s, 40s in her picture, and I was in my
Mm.
20s. But we're
Hmm.
wearing the exact same color, and we look alike. It's
Nice.
uncanny how
Oh, that's
much we look like.
wonderful. I love it. That's great.
And and it just she would get down on the floor and play dolls with me when all the grown-ups were playing card games and whatever, and
Mhm.
because we used to have them over between Christmas and New Year because Auntie Annie's birthday was then. So, and
Right.
she was the one that would get down on the floor with me. And she was kind of an eccentric person.
Hmm.
And
Okay.
that's kind of how I knew her. She was kind of this strange person. Um, in the middle of summer, she would wear this heavy, heavy fur coat.
Oh, is she the one with all the layers?
Yes. She
Yes.
ended up, when I was probably around 7 or 8, she ended up passing away from breast cancer.
Mhm.
She would literally put put bread bags between her skin and her clothes so that people couldn't tell that she was literally had open sores that were seeping. That's how bad it was. And so when they eventually took her to the doctor, someone, her sister who lived in the same house, like she had an apartment off of her sister's house. When her sister eventually found out what was going on and they took her to the doctor, she was gone within a week or two.
Wow.
Yeah.
Wow.
But I loved this aunt. I figured she was kind of cool.
She was
But
different.
yeah,
Yeah.
but my mom always referred me, oh, you're so much like your Auntie Annie. And of course, the way she would say it was, she was meaning it as a derogatory, well, all, and she would say it when I would, especially when I went to vacuum, because I
Oh.
had to vacuum a certain way and I could not go off that way. Or I would she wanted me to vacuum a different room out of sequence, and I pretty much had a meltdown.
That's an
So,
autistic quality. That's not a, it's not saying you have autism, but that's an
yeah.
autistic quality. Yeah. Oh, very interesting.
So growing up being
And how does that make you
compared,
feel? Sorry.
being
We're talking about psychology today, so yeah.
being compared to these two aunts, when I was told I had to go to see a psychiatrist, I was petrified because I did not want to have the same labels of my aunts. And I didn't know because nobody told me. It wasn't until after my mom passed away, I actually asked Dad. I said, okay, Dad, Auntie Lillian, if she was what would she be classified in diagnosis today if she were alive? And he said, well, she would be, just a second here. Water bottle so the kids behave. If she were diagnosed today, she would be diagnosed as Down syndrome. Now, I had seen pictures of her. Granted, they weren't very close up pictures, but the pictures that I saw of her, I said to Dad, but she doesn't have the characteristics, like the physical characteristics of someone with Down syndrome. And he said, no, she didn't have too many of the physical features, but that's what she would have been diagnosed as. And I said, okay, what about Auntie Annie? And he said, probably OCD, because things had to be in certain order. She didn't trust banks, so when they were cleaning her place out, they kept finding all these envelopes, and they were just tossing them that literally would go into a bin to be dumped into the fire barrels and burned.
Oh no.
And they had probably been cleaning, they probably were almost halfway through the cleaning, and one of these envelopes jingled. So they looked in it and there was money. Yeah. And so they started opening every envelope that they found, and there was money in every one of them. So they have no idea how much they burned without knowing.
Oh my word.
Because
Wow.
she would get her checks and she would
Yeah.
pay for her rent and pay for her food, which her
Right.
sister would do the shopping for her and stuff.
Did they
And
live
then the
together,
rest
she and
would
her
just,
sister?
she had an apartment just off of her sister's house.
Oh, okay. The sister I knew. Oh, got it. Yes,
Yeah.
yes. Got it.
Yeah. Yeah.
Okay.
So when you would go into their house, there was kind of a hallway that went, and then you would turn left into my aunt who had the family. And my other aunt was to the right.
Right. And that other aunt has passed as well. So are you okay with
Yeah.
naming her? Okay, yeah,
Yep.
Marie. Yeah.
Auntie Marie, and my Uncle Vern, both of them have passed as well.
Yeah. Oh, I knew them. They were sweetest people. Man,
Yeah.
you could not get a word in edgewise when you were around Vern. Oh my word. And then when you got Marie away from him, you couldn't get a word in edgewise from her because she was so used to being quiet for him. Yeah, it was hilarious. And do you think she hid money as well? This is Indigo has a good question.
Yeah,
Her aunt
that's
found hundreds of dollars in books, robes, coats, shoes, everywhere.
well. As they started to find when they finally started opening the envelopes, they were finding that every one of them had money. So she was probably, because she didn't trust banks. She also didn't really trust government or like doctors or any of that stuff.
Mm-hmm.
She was growing up. She grew up, and my dad grew up in a very staunch English German home.
Okay.
So Grandpa was German and ruled with a hard
Mm-hmm.
hand,
Yeah.
and so they were just. I don't know if it was common, if she really hid the money because of the Depression era, or if it was just that was from my understanding. And if I say something that someone takes offense to, please, I'm not saying it to offend anybody. It's just these are the values I grew up knowing. She followed her mother in the very English ways from back then, where you don't go to doctors, you don't. Um,
That was
in
also in the
essence,
days when she was young. That was also in the days before we had universal health care. So you would have had to have paid for it, and it would have cost a lot of money. My mom talked about it from when she was a little girl, having to pay for her doctor's appointments.
well,
Sorry for interrupting.
this was in the 80s. Like she passed
Oh,
away in 87 or 88.
how old would she have been?
That I don't know. Um, okay. 88, my dad would have been. Okay, dad is 84 right now.
Is he
So he
really?
would have been, yeah.
He's old.
So, and your mom's what? 82?
No, she's not in her 80s. No, no, her
Oh, okay.
brother's turning 80
Oh, okay.
soon, and he's a few years older than she is. Yeah.
But I think a lot of with Aunt Annie, it was because she didn't trust anyone.
Yeah.
And so she would just hide money. It was part of what they figure was the OCD.
Mm-hmm.
Um, well, hearing about my two aunts and being compared to them constantly, I didn't want to go to see a psychiatrist because I
For
was scared
sure. Oh,
I
yeah.
would be crazy like my aunts.
Yeah.
And because that's more or less what my mother said was my aunts were crazy. Um, so I didn't. And then you look at the fact that in Saskatchewan, it is very difficult to get in to see a psychiatrist.
To give Saskatchewan at least a little bit of not a pass, but it's the same everywhere in Canada. It really is. We just don't have enough medical professionals.
Yeah.
We just don't
But
pay them well
okay,
enough.
okay. This is why I say it's really hard to get in to see a psychiatrist.
Mhm.
With a medical doctor, you can find a medical doctor and you can call the clinic and you can book an appointment.
Mhm.
If they're taking new patients, you can book an appointment to see a doctor. You can see them, you can figure out whether you like them or not, whatever, and go from there. With a
Mhm.
psychiatrist, they have you have to be referred to a psychiatrist
Mhm.
by a medical doctor.
Yep. They're a specialist.
Yeah.
Yeah.
And that's where I had the problems.
Yeah.
Because by then I was done seeing male doctors.
Yeah.
I had to see male doctors in this community that I live in now.
It's all that was there.
And even the female doctors that I saw here when I first kind of moved, the first few years that I actually doctored here in this community, I would see one the first time, things would be okay. See them the second time, I'd start to get the attitude from them. By the third time I would see them, it was, oh, you're just trying to get attention.
Thanks.
No,
Hey,
I'm in
Sam.
my,
Yeah.
I
Yeah.
am doing my damnedest as a 30-plus-year-old
Yep.
lady,
Yep.
just learning to listen to my body
Yes.
and saying, okay, what is this?
Mhm.
Why am I feeling this? Is this normal? Is this something not normal? And so I would go in with these pains, and of course,
Yeah.
whatever it was.
It was obviously
So
psychosomatic.
yeah. And because I've had so much troubles with doctors, I have also been one that when I first see a doctor, I am very open and honest with them and I let them know that I'm a survivor.
Yep.
Now, the medical community is slowly catching up that when you say you are a survivor,
Mhm.
they treat you better, not like you're just
Not
trying to get
worse.
attention.
That's right. Yeah.
And that has taken a long time
Yeah.
to come in.
Yeah.
So I had gone to the doctor that I was seeing and I asked for a referral. And a couple months later, still hadn't heard anything, went to the doctor again. What's going on?
Mhm.
Well, I keep getting rejections and they don't want to take new patients and yada, yada, yada. Finally, I got to the point where I knew I had to go and see a psychiatrist. And I
Mhm.
knew I needed to see him soon, someone
Mhm.
soon. Because what I had been told was I was not allowed to go back into this treatment facility until I had an actual diagnosis.
Oh, okay. Yeah. 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 Okay.
And I knew I needed to go in because I needed to deal with stuff that I couldn't just open up in a hour to 2 hour session with my counselor and then slam the door shut and go back about my normal life. I knew I needed that time where I could take down the masks and um, I lost my train of thought. I knew I needed a time where I could go in to treatment so that I could take the masks off and keep them off for a couple of weeks before I had to put them all back on again. So I could actually deal with stuff. But I couldn't
Mhm.
until I got all this
Yeah.
other stuff figured out.
Yeah.
Come here, Leo. Come here. He's meowing.
I'm just going to
Um,
point out Samara's comments here. Her mom's boss was from South Africa and he welcomed her as a doctor here. Excellent. He and his wife were schooled in Britain. She's a psychiatrist. My psychiatrist happens to also be Krystal's psychiatrist, was also schooled in Britain. Part two, they wouldn't let her write her boards because they don't need any more of that specialty in Saskatchewan. Oh my word.
Boy,
How Sam, how long ago was this? Um, was this in the 80s, 90s, 2000s even?
come
Like
here.
when was this? Yeah. And Indigo's right. That is heartbreaking. That is absolutely heartbreaking. Because I mean, even if there's an overabundance, which there's not, but even if there was an overabundance, we could use them all. There will never not be a need for psychiatry,
There's,
for psychology, all of
I
that.
think, I think right now there's something like a 2 to 3 year waiting list to get in to see a psychiatrist.
I thought it was only 8 months or so, like less than a year.
Oh wow,
7 years ago.
okay.
Wow. Oh wow. Yeah.
Because
Yeah.
I
No,
know it was.
that's.
So what I had ended up doing was um, I had actually asked some of the ladies that were at this treatment facility as
Hmm.
clients. I asked them because a lot of them had been um, in the psych ward, and so they knew a bunch of the psychiatrists.
Hmm.
And it was funny because the one that would come out to my town,
Yeah.
I said, "So what about?" and said the name, and they're like, "Oh, you do not want to see him. No, 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 no. He is not good." The funny thing is, I saw him from down the hall, and it wasn't until later that I was told that that's who it was.
Oh.
And just seeing him down the hall, I'm going, ugh. I
Oh.
just didn't get a good feeling about him. And then I find out,
Oh.
and yet my friend who was a counselor said, "Oh, he's a really great guy." I'm like, "Yeah, no." And she goes, "Well, listen to your gut then."
Yeah.
Because
Yeah.
as we all know, when it comes to abusers, they can look absolutely perfect and be absolutely the best person in the world to
Yep.
everybody else except for whoever they're being abused, whoever they
Right.
are abusing.
Hey, Daniel, you made it to a live. Nice to see you. Yeah. The very first psychiatrist I was um, booked in with. I'm not going to say they were my first psychiatrist because I didn't. I went to one session with them, and it was a husband and wife team. Um, their office was right beside the hospital that's in the bad neighborhood in our city.
Okay, yep.
Um, and I got in with them within about 3 weeks. And my doctor's like, yeah, I want you to go to these people because you can get in really quick and yada, yada, yada. Well, I found out that if you can get in really quick, you don't want them. You don't.
Yeah.
It is, yeah. No, it was a very bad omen that these people were available. They were awful, 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 awful. I actually talked to a friend of mine who happened to go to that particular doctor. And when she told me about ugh, the treatment that they wanted her to do, I nearly vomited. It was awful. It was just horrible. So, I mean, it was abusive. It was actually abusive. Um, so, yeah. Yes, Sam, it's your hospital. Um,
Yep.
her it has to be her hospital because the kidney transplant wing is in that hospital. So
Yeah.
that's why it's her hospital. Um,
So
yeah.
I ended up having to advocate for myself, and I was getting tired of my doctor giving me the runaround. So finally, I sat down and I wrote a letter
Hmm.
to my medical doctor, and I pretty much put, "Look, I am trying to get help, and I am trying to find a psychiatrist, a female psychiatrist.
Hmm.
I can't phone them and book an appointment. So I need you to advocate for me and get me in to see somebody. And I gave her
Mhm.
that letter, and I gave her another name. And when I gave her that letter and she read it, and because I was giving her names of people to refer me to.
Oh,
So, yeah, so that
okay.
hopefully I could get in to see them.
Yeah.
Try this one, try this one. I hear this one's good.
Yeah.
And when I gave this letter to her, the next referral letter that she sent out to the doctor that I had had asked, she sent this letter that I had given to her. And um, that was the clincher. This lady psychiatrist reached out and said, I wish I had openings, but I don't. My colleague, um, who is a male psychiatrist, he has some openings,
Mm-hmm.
or possibly has some openings. Contact his office. So I
Mm-hmm.
contacted his office, and I was given the choice of either waiting to see him,
Mm-hmm.
or I could get in sooner by seeing one of his residents who is just about to completely graduate.
Okay.
And because I needed to get into the house again sooner rather than later, I agreed to see this guy.
The resident.
Yes.
Okay.
So he just had to finish one or two more exams, and then he would have been full-fledged out on his own.
Oh, perfect. Okay.
So perfect timing, because he doesn't have an actual clientele.
Right.
He's not completely booked up with people yet.
Yeah. Oh, yeah.
So I went in to see him, and by then I was already on one antidepressant that I
Mm-hmm.
had gone on probably about 4 or 5 months after moving to the community I'm in now. Um, and I saw him, and we talked. And at this point, I was literally sleeping maybe 2 to 3 hours a night, and having to go hard at work for 8 hours on my feet the whole time, doing a lot of lifting because I was in the claims department by then. So I was literally, without even realizing it, lifting 40 and 50 pound boxes.
Whoa.
And I wouldn't even know, like, I would be lifting these boxes, I would lift them onto my scales to send them out, and see that the scale said 50, 60 pounds, and I'm going, oh my goodness.
And was it
And to me
fairly
it was
easy for you
nothing.
to lift, or was it just really
Yeah,
was it really, really rough? Wow. You go, girl.
it was
Wow.
weird. Like when I was told I could only, after when I went for one of my surgeries, they said you're only allowed to lift 10 pounds. And so I'm sitting there going, okay, what? How much is 10 pounds? And so I finally found something that
A
was 10
beverage.
pounds. Nope, a gallon of paint
Oh,
is 10
wow.
pounds. So that's not very much.
No.
I'm going, oh my goodness, I can lift a case of those, which is four
Yeah, 4
gallons,
gallons. Yeah.
without blinking an eye. Now,
But right after surgery, you can't. Yeah.
yeah, now I have troubles doing that.
Mhm.
But I finally got in to see this guy, and I told him that I was scared and why. And so we
Mhm.
talked, and he diagnosed me with, he officially diagnosed me with PTSD. Um, and then he also diagnosed me with major anxiety disorder, major depressive disorder, and seasonal affective disorder.
Oh, wow. Okay.
And
Yeah.
I don't think social anxiety was quite in there at the
Yeah.
beginning. I think that was
Yeah.
the next
Just,
psychiatrist I saw. So it was
yeah.
literally mad, sad, sad, and MDD. So I'm getting
Yeah.
all these little names behind or letters behind my name.
Yeah. That's what I say is I have lots of a lovely alphabet after my name. None of it has to do with PhD.
Yep.
Yeah. I'm just
I
going to
usually
comment
say,
here. Indigo says antidepressants saved her life.
yep,
Absolutely. Yeah. And switching between medications or having to last while I have to get a follow-up to get to refill. Oh no. Okay, yeah. You have to switch SSRIs and then get a refill. That having to wait
yeah.
is awful, awful, awful. Yeah. Yeah, no, that's someplace you do not want to be.
Yeah.
So with all those
So,
diagnoses, what happened?
well, with that, and because I wasn't sleeping very well, and my mentor at the time, she couldn't figure out how I was going as and doing as much as I could on as little sleep as I was. For the
Practice.
most part, I would most of the days, and I don't know how to really describe it, but when I get really really tired, I shake, and
Hmm.
it's not an anxiety shake, but it's just this. Your whole body is this kind of almost hovering,
Yeah.
for lack of a better term.
Oh yeah. Hola Maritza.
Hi, Maritza. So then he says, okay, we're going to try you on. I can't remember. We ended up going through about 4 or 5 antidepressants before we found one that would work.
Yeah,
Um,
absolutely.
one of them, I absolutely. Okay, the second one he had tried me on, um, I ended up in such bad way. I was freaking out so bad at work that I was I was shaking like this and couldn't stop it. And it was starting to
Wow.
really hurt. So I went to my
Yeah.
pharmacist and I said, this isn't right. And I showed her because I was shaking like this at work.
Hmm.
And she said, okay, I will fax your doctor and get him, see if he can put you on something else. So he did the third medication, he just sent in without talking to me about or whatever. I read the papers because I wanted to know about whatever I was being put on, and
Of
because
course.
I didn't want it to interact with the one that I was already on. I didn't want it to interact with the IUD that I had in for my endometriosis, because that's always been my fear with anything I'm going on.
Hmm.
So I
Hmm.
was reading all of these um, side effects, and one of them was it can bring on diabetes. I
Hmm.
go, whoa, no, not going in that one, not trying that one. Because both my parents are type 2 diabetics.
Yeah.
My dad's dad died of complications to diabetes. My mom's
Yep.
mom died of complications to diabetes. I was not going to start a medication that could bring on diabetes,
That's right. Hello, Alfonso. Nice to see you here. Yeah,
especially
that's yeah.
considering I've already been told, like, I suffer hypoglycemia, which is low blood sugar, but I have also
Right.
been told that it could end up eventually turning into diabetes
Hmm. Okay.
because of the family history.
Interesting. So you have an overactive pancreas and it could maybe just get worn out or something. I don't know.
I don't know. I
I don't
don't
know how medically
understand
it
it.
works. Yeah.
My mother has had high blood pressure all of her life, and the last time when I had my physical and my doctor, I had low blood pressure,
Mm-hmm.
which is weird because usually I'm spot on or
Yep.
yeah.
Okay.
So it just, but seeing this guy, so of course when I saw that as one of the symptoms, I told my pharmacist there is no way in, you know what, I am even going to attempt to start this. No
Yeah.
way. So then my pharmacist let my psychiatrist know this to try and get something else. So my psychiatrist ended up phoning me and talking with me and saying, so what is the absolute needed right now for you? What is the thing that you're struggling with the most?
Yeah.
Besides like the depression and the anxiety
Yeah.
and yada yada yada.
Except for yeah.
Yeah. And I said, well, I'd like to be able to sleep
Yeah.
and be able to possibly get some extra energy because of that.
Yeah.
And so he ended up putting me on the one that I'm on now, my second one. So I have one that I take in the morning
Mm-hmm.
and one that I take at night that helps me
Yeah.
sleep.
Yeah.
And so I've been on those for a number of years. But
Mm-hmm.
he was very compassionate, I guess, as we
Mm-hmm.
started.
Mm-hmm.
But as I went, like once I was on a medication and we had kept on it for 3 months and things were still good, he said,
Good.
okay, phone for a 6 month follow up. And so I phoned for a 6 month follow up, went
Mm-hmm.
in, and when I got in there, he says, why are you here? And I said, well, you said I was supposed to um, come in for a 6 month checkup. Oh no, I don't want to ever see you again. Okay. He says, your regular doctor can prescribe this stuff. Just don't want to see you again.
Because you're not complicated or anything. Like you have everything under control. Oh.
And
Indigo was on sertraline for years, from 19 till she was 30. So for like 10, 11 years. And then got acid reflux during lockdown. Yeah. Yeah. Our bodies change under stress.
yeah,
They really change. Yeah, absolutely.
citrulline was one that I couldn't take.
Mm.
Um, it's the higher dose of one that the very first one that they had tried me on that stopped working within like 3 months.
Wow.
And so that was one. Prozac I've tried. That one, if I remember correctly, the Prozac is the one that I ended up having to drive 2 hours in a blizzard, shaking extremely hard
I'm only
because
laughing because I know the story.
the doctor had just been seeing me for very much, not for very long, and so she
Right.
wanted to see what the side effect was that I was
Right.
having.
Right.
When I got there and she saw how bad I was shaking, and I'm not saying that everyone's going to have that effect.
No.
It works wonders for a lot of people. And so
Yeah.
I I walked in to the office, and when she came and got me out of the waiting room and she seen how bad, like I was literally shaking like this, and she's like, how did you drive? I'm like, holding very tightly to the steering wheel.
Okay, now for full disclosure here, Krystal and I share a psychiatrist. So I know exactly what the look on her face would have been. She'd been like,
And she's
yeah,
like, does that hurt?
Yeah.
Yeah, it really hurts.
Yeah.
And so she told me, don't take it again.
Yeah. You stop now. Yeah.
Yeah. Um, in answer to your question, Indigo, could I report him for saying that to me? Yeah, I'm probably could have. The only thing is, um, in Saskatchewan, and it might be all across Canada, if you report a doctor, you are the one that ends up getting blacklisted. Yeah,
Really?
yeah. Because
Because you're a trouble patient.
well, no, I wanted to report my doctor that told me that the depression wouldn't have been that bad with the interaction with the Depo-Provera injections and being antidepressant.
Yeah, yeah, yeah.
And I was talking to a doctor friend of ours, and
Hmm.
he said, Krystal, don't, because it's going to blacklist you from ever being able to get a doctor again.
At least he was a good enough friend to tell you that.
Yep.
Oh,
He was actually
wowzers.
he was the chiropractor that I had been seeing since I was a baby,
Okay, yeah, yeah.
and so he had become a family friend.
Yeah,
And the medical system is so different in Canada from the U.S., where
absolutely.
malpractice and all of that, you can't
Yeah,
just report somebody and yeah, it's
yeah.
tough.
It is.
So I've had to muddle through.
Yeah. And you
But
have to advocate for yourself as well, though. Like you can't
and
just sit and take it.
I have had to do that constantly with doctors.
Absolutely. Yeah.
So fast forward a number of years, and I'm still on the one at night and the one in the morning. I'm now on the highest dose of both,
Hmm.
and the one has been raised from medical doctors over the years.
Mm, okay.
In 2015, September of 2015, I had a hysterectomy, a complete hysterectomy. And in the process of having that hysterectomy, there was something traumatic that happened in the surgery that I'm not completely sure about. Um, I know bits and pieces, but because I figure something happened when I was under anesthetic that I can't remember. And because of all of that, I ended up with extreme anxiety, worse than I had ever had before.
Wow.
And so I found myself having to I ended up in hospital to going back to emergency the day after I came home. And literally made somebody drive me the 2 hours to go to the
Yeah.
hospital that I had my surgery in.
Yeah.
And I was pretty much told that I was more or less just trying to get attention. Um, I'm not going to say the actual word, but there was a young male resident doctor, who was the one that finally came in to see me at like 12:30 at night. And by then I was crying. I was in a lot of pain. And I had friends with me. One of the lady that stayed in the exam rooms with me, um, she was one that I worked with um, on women's ministry in our church. And sweet lady, um, she knew my story, but she didn't know what was really going on inside me at this point in time.
Fair. Yeah.
And I'm freaking out. And
For
so
sure.
finally, the doctor this male doctor came in and he said, well, there's a psychiatrist that's on call at the university hospital, and I can maybe talk to her, whatever. And so I guess he kind of started to talk to her, like he was kind of on the phone, and he come back in, and I was just in the process of starting to tell this friend of mine what was going on. And so when he came in, he said, you're just trying to get attention, aren't you? And I said, no. I said, it feels like I am sitting on a,
Mm-hmm.
24 hours a day and being
Mm-hmm.
triggered because
Mm-hmm.
I had gone home with a catheter in. And so yeah, anyone who's had a catheter in knows exactly what
Mm-hmm.
that word is.
Yeah, starts with a D and ends
And
with a dough. Yeah.
well, no,
Oh, well,
start
we'll
starts
say
with a
that's what it
P.
is, though. Starts with a P and ends with a nis. Yeah, got it.
But
Anyway, so continue.
those words were not words that I could even say at that point. So
Yes.
I was literally crying in hysterics at this point, and to say it out,
Yep.
he turned and left the room with the phone in his hand. He came back in a few minutes later,
Mm-hmm.
and his attitude towards me had changed 180 degrees. He was
Yep.
caring. He was okay. This is the psychiatrist that's on call, and I've talked to her, and she said, okay, we'll give her some Ativan and to calm her down. And I was told how much I was allowed to take,
Yep.
which was a lot more than normal.
But when you're in the middle of a panic, you need
Yeah.
that, right?
Well,
Yeah.
during that time while I was so stressed, I could take up to a certain number
Yeah.
a day.
Yeah.
And I was literally at that max when I went back to work after my surgery because
Wow.
I couldn't handle it.
For
So
sure.
I eventually called and got in to see this psychiatrist that had been on call, and she tried to start me on another antidepressant to go with the two that I was already on, which I did not react well to. The
Mm.
first one that she wanted to put me on was the one that I had been on, my second one that I had been on when I was still up in the small city.
Got it. Yep.
And there was no way I was going back on that stuff because that had made me gain a good 60 pounds, and I
Yep.
hadn't gotten rid of all of it yet, and
Nope.
did not want to go through. And plus, when I was on that one, 5 minutes behind the wheel of a car, and I could not keep my eyes open.
Ooh. Ooh. That's dangerous.
Mm-hmm.
That is
So I
dangerous.
couldn't
Yeah.
drive. And then when you have to drive everywhere to get to doctors, because by then I was doctoring, every doctor was in the city.
Yeah.
So that I could actually have consistent doctors.
Right. Yeah.
So in seeing her, I saw her a couple of times, and then she kind of did the same thing. She's like, I'm going back to full-time teaching instead of seeing any clients. So you can just get your refills and stuff from your medical doctor. But at least in the time that I was seeing her and in that little bit of time where she was trying a couple of different meds with me, I was able to get back down to not having to take the Ativan all the time
Mm-hmm.
and more than 0.5 a day.
Yep.
So it was crazy. But by then we had finally gotten, it wasn't the same psych nurse at the clinic in the town I'm in that I didn't get along with. and that didn't understand me, because I had literally started seeing one of the psych nurses that had started
Mhm.
here,
Mhm.
and she had never heard some of what I'd been through, and she was surprised and sickened
Oh
by the
yeah.
depravity of
Oh
what I
yeah.
had been going through. That they had
Absolutely.
finally gotten a female counselor in adult mental health, so I started seeing her, and then I had
And
to
she's the
stop
one you're still
seeing.
seeing, right?
No,
Oh.
no, this was
Oh, this
9 years
is
ago, or
oh, okay.
no, this was before my hysterectomy,
Oh, okay. Yeah, yeah. Got it.
and she was really good, but then I find out that Saskatchewan had changed their mental health stuff, where you were only allowed 6 sessions with a mental health
Oh,
professional.
paid for. Yeah.
No, it wasn't. I was not allowed to continue seeing her because I had been in the care of mental health in this community since '96, when I was down in this area for Bible school.
Okay, that has changed drastically
Yeah,
because I know for a fact you can continue on. Well, you have been with your current psychologist or with your current
yeah,
counselor. Yeah,
but she is private. My current counselor is private.
got it. That's what I'm
And,
saying. They wouldn't
and
let you have more than that on a social right. Okay,
yeah.
got it. Yeah.
So, yeah, it was, again, seeing a new counselor. I eventually got in to see the psych nurses.
Mhm.
And so the psych nurses started changing. I had a really
Mm.
good one, and I was seeing her around the time of my surgery. And she was actually the one that referred me to the psychiatrist that I see now.
Oh, okay.
And like I had asked her, I said, because the psych nurses quite often know the psychiatrist from in the city.
Yep.
But my psych nurse had even more to do with the psychiatrists in Saskatoon, because she would work at the, and I'm going to get the name wrong, Dubay Center?
Dubay Center.
Yeah, Dubay Center.
Yeah.
So she knew a lot more of the
Dubai is a city in
psychiatrists.
Saudi Arabia.
It sounds so similar sometimes that it
It
just.
does. It does.
So it was tough to, but it was easy to get in to see this psychiatrist, because I went to my doctor. Actually, I think it was my psych nurse that was able to refer me, which got me
Oh,
in even faster.
nice.
So, and I've been seeing her
Yes.
ever since. And at that point, we were actually, my psych nurse and I were talking, and I was beginning to think that, and this was about 8 years ago, I was starting to wonder if I had either bipolar or borderline personality disorder.
That long ago, did you know what borderline personality disorder was? Because I had not heard of it
And
until, well, I guess maybe the last 6 or 7 years. But yeah, I
I
had
had
not heard
heard
of that before.
I had heard the name,
Hmm.
but and I
I guess,
was
yeah, I'd
kind
heard the
of,
name.
and we would, like, the psych nurse that I had was up on everything, because she just graduated a couple years before.
Okay.
The funny thing is, at the time I was seeing her, I think she was only like 2 years older than my daughter would have been.
Yeah.
It's kind of funny.
Kind of makes you feel old, don't it?
Yeah, well,
Yeah,
when there's only 13 years between yourself and your
that's
daughter.
true. Well, that's true. Yeah. Yeah.
But she was incredible, and so she was the one that got me in to see the doctor I'm seeing now. And her and I had been talking about which one And we had actually kind of come down to the conclusion right before I went and I saw um, my doctor that I was probably leaning more towards the borderline personality disorder
Mm-hmm.
than the bipolar,
Mm-hmm.
because I didn't have the extreme highs and lows,
Mm-hmm.
and I was more down than up.
Mm-hmm. There's a few
um,
other features
and
that do separate them. Do you know what those are?
um, the the ideation.
Nope, that's the same in both.
Um, I can't even remember them now. I the like the okay the id the way the ideation is separated is different for both.
Okay. Okay.
Um, with BPD, which is
Mm-hmm.
borderline personality, um,
Mm-hmm.
it's it's higher on the scale. Um,
So you have it
one of
more
the
frequently.
Yeah,
Okay.
and for me it's almost a daily. For the
Wow.
long Yeah, for the longest
Wow.
time, if there was a day I didn't think of it, those were the days I had to be more concerned,
Oh, wow.
because it was so common that if it
Yeah. You had to look for
wasn't there,
abnormal,
it's
and
like,
abnormal was normal. Yeah.
yeah. One of the other differences is One of the main differences is you literally your emotions are all over the place, but you can go up and down and up and down and up and down in a day. Where with bipolar, your emotions are more in a kind of a more fluid, longer
There
time spans between.
there is a type of bipolar called cyclothymic, and that is up and down, up and down. But like you said, your ups never went to psychotic level up.
Yeah.
With cyclothymia, they will go
So
to psychotic level up and then down.
I don't think psychosis is one of the main ones in BPD.
It's very
Um,
rare in
yeah.
BPD psychosis. Yeah.
The the one that is my big one, um, I don't know how to regulate emotions.
Yeah. Yep. That's a big one.
When it comes to strong emotions, um, especially anger, I can
Hmm.
go 0 to 100 just like that, snap of a
And
finger.
you have no control over it. Like that's the thing people think is that, oh, just stop for a second. Just stop for no, you can't. You literally cannot.
Yeah,
There is no choice.
yeah.
Yeah.
And like, because both of them are so close together, that's why I wasn't sure which one it was.
Yeah. Oh, it can also be an
Um,
autistic trait too, the lack of
yes,
emotional regulation. Yeah.
yeah. That's another one that I have in some of the research I've been doing in the last few years. There is a lot of similarities between autism
Hmm.
and borderline personality disorder.
Right. Right.
Um, with borderline personality disorder, keeping your stress at bay.
Hmm.
When you're stressed, it's extremely hard to keep your symptoms at bay.
Well, that would be same with autism as well.
Yeah.
With autism, though, there's also the features of texture and
Oh, I
physical
have that too.
sensory. No, no, but it's more pronounced with autism.
Yeah.
So yeah, there are so many diagnoses that have so many overlapping
Yeah.
areas. It's just one will have that little more pronounced, little more pronounced. This one, but yeah,
Yeah.
that's a big one. Something that's
I
not common in bipolar, it happens, but it's not common, is self harm. And my daughter's best friend suffers from actually she was sober from self-harm for almost a full year until recently. Something just triggered her and she hurt herself, but she had been away from that for so long. I was so proud of her. I'm still proud of her, but I
Yep.
know the stress that it would take to keep yourself under
Yep.
that type of control, right?
Yep.
So, yeah.
Another one that one of the things that really helps me is schedules, keeping
Mm,
schedules,
mhm,
having routines,
mhm,
being able to do things in specific orders. And I've been like that all my life.
mhm.
But borderline personality disorder, um, now this is my understanding of it, and I just lost my train of thought.
Borderline personality disorder, your version of it. If you want, I have it in my book.
No, it just like for me, keeping schedules, keeping things in order really helps. Um,
Yes.
Not putting myself into stressful situations,
Yes. Yeah.
being able to work at my own pace, which thankfully
Mhm.
I can do in my job now when
Mhm.
I do eventually go back to work. um, what's some of the other ones? But when I went in to see my psychiatrist that I have now, when I went in to see her for the first time, she actually had a student in with her.
Oh, yes.
And
Yep.
I am normally not one that likes to have students in with me just because of um, me having a hard time trusting people and needing to learn to
You've been
trust
hurt by the
doctors.
people closest to you for so many years.
And I've been hurt a lot by the medical community.
Yes. Yeah.
And so I kind of went in with trepidation, but I thought, maybe having two doctors hearing what I'm going through
Yeah.
and everything, um, I just thought, well, maybe two heads is better than one. I don't know.
Yeah.
And so when I told them everything that was going on and everything else, I had had my hysterectomy about a year before, and so I was still fresh on all of that stuff
Yep.
and everything that had triggered. And so I was at the end of it. I asked her what she thought, and I was told borderline personality disorder. And then she gave me the name of a book that I could read. Well,
Oh.
in looking for that book, I ended up picking up one, and she said it's a really good one to read because it tells you a lot in layman's terms
Oh,
about
okay.
BPD. Well, I
Do you
ended
know
up
the name
picking
of the
up
book?
the no, I can't remember it.
Oh,
I
okay.
ended up picking up the wrong book to begin with, and it was
Oops.
more it was like the clinician's guide.
The
So,
DSM-5.
well, no, it wasn't that bad, but
Okay. The DSM-5 is the Diagnostic Statistical Manual. That's DSM, Diagnostic
yeah,
Statistical Manual 5, and it's the fifth version.
yeah,
And
yeah,
I think they might be on 6 now. So yeah, the DSM is.
6 or 7. I think they're getting ready to put number 7 out.
Are they? Okay,
I think so.
yeah.
But the thing with borderline personality disorder is in my research that I've been um, doing the last little while, one of the other what they're trying to do, and they were trying to get it for number 6, but hopefully the changes will be in the next edition of the
Okay.
DSM. What they're trying to do is they're saying that with borderline personality disorder, it's more developmental trauma, because it's
That has
all
caused
rooted.
it? Is that what you're saying?
Yes. And they're
Oh.
wanting to change it. Instead of borderline personality disorder, they're wanting to change it to developmental trauma, which
Hmm.
encompasses everything. And because one of the big symptoms of having BPD is CP, um, CPTSD,
Hmm.
complex post-traumatic stress disorder.
That's right. Yes. Yes.
And that is from The Body Keeps the Score by
Gabar
Bassel van der
mate.
Kolk.
Oh.
No, Bassel van der
Oh,
Kolk.
you're right. You're right. Yep. My bad.
Yeah.
Okay. Yeah, the
Gabar,
DSM-5 is
Gabar
the
Mat.
current. Gabar mate does a different one.
It's
Yeah,
actually Gabar Mat.
Gabar mate. Okay. Anyway, so the
I've
DSM
actually
current.
met him.
Oh, have you? Oh,
I've heard him
cool.
speak, yes.
Neat. The DSM currently is at level 5.
Okay. So it was
So,
when they were
yeah,
going from 4 to 5, they were hoping to get it put into
right.
5, the
Okay.
change.
Oh,
And Dr. van der Kolk is not the only doctor that is working at getting it changed.
no.
There's
Right.
his whole team.
Right.
So it's an interesting disease. Um, up until okay, the reason a lot of people haven't heard about it until more recently is because even when I was diagnosed 8 years ago, about 8 years
Mhm.
ago,
Mhm.
um, it was one that psychiatrists were very cautious
Yes.
in diagnosing.
Yep.
There was a lot of people that were diagnosed as bipolar
Yep.
instead of BPD.
Yep.
And the big reason for that is because insurance companies would quite often not cover the the medication or treatment for BPD.
Yep.
BPD is one that, like a lot of these psychological diseases, it can be treated,
Mhm.
but you'll never get over it.
Right. Well,
And
that's also it's a disorder. Disease will kill you,
yeah,
disorder won't. So that's at least how it was
um,
explained to me by our current psychiatrist.
the really neat thing about being diagnosed with BPD
Mhm.
and learning what it was, and that the big thing is learning how to regulate emotions. I finally had to get the the therapy for what I had
Mhm.
been asking for years, because I didn't know what emotions were. I didn't know how to regulate emotions, and I knew that. But I was having so much trouble trying to get counselors to work with me in trying to figure out emotions
Mhm.
and what they're supposed to look like, how you're supposed to react, all of that stuff. So finally I had to look at that. And my current counselor has been my counselor since about the same
Yeah.
time as my psychiatrist. And I just I was so happy to be able to actually start to get the therapy that I kind of knew I needed.
Having a name
Yeah,
makes it less scary, right?
it
You
was
think, "Oh,
it
I'm not
was
crazy. There's a name for this. I'm not an outlier," right?
I can't remember exactly how I wrote it, but I'm sure it'll come up in my memories in the next few months.
Mhm.
um, I more or less talked about how, as much as I was happy to have a diagnosis, it also scared me.
Oh yeah, because now you have a
Um,
label.
but I also had a label.
Yeah, I had a label, but I have a label, but I have a label, but I have a label.
Exactly.
Yeah,
Yeah.
exactly.
Now,
Yeah.
for the majority of people with borderline personality disorder, there
Hmm.
is a type of therapy that
Yes,
is very successful. It's called
but you're not the majority, my sweet.
it's called DBT, or dialectic behavior therapy.
Hmm.
To me, I would sit there and I have looked in. I have the handbook,
Oh,
and I
okay.
have literally looked at it numerous times. And I sit there, and I've even said to, like, we've tried working on it with the counselor I see now, and every time we try and work on it, I'm even in the first couple of pages, I'm going, I don't understand it. What are they asking for?
Yeah. What's the purpose?
I I didn't know what the answer was to the questions.
Yeah, yeah,
And I didn't want to answer them wrong.
yeah. And Indigo's right. Labels do give a way to help yourself, but there's also a stigma in society about it. So the
Yeah.
label can be scary in that sense. And I'm just going to address that a little bit, Indigo. One of the things that I do on a very
Oops. You're frozen. Kim, come back to us.
okay then. Fine. All right. So we're back. Um, uh,
Whoops.
so apparently, I'm not supposed to talk about my own journey. No, but what I do is I talk about my journey with mental health. No, you didn't break it,
No,
Indigo,
you didn't
but
break
I appreciate your attempt to try to take
it.
responsibility. No, but so I talk about my journey with mental health. I work with the Schizophrenia Society. So we have somebody with schizophrenia, somebody with either bipolar or major depressive disorder, usually also a family member of somebody who's had one of those types of mental illnesses, and then a medical health, um, not practitioner necessarily, advocate, medical health advocate. And so that I've been doing since 2011. Things have changed medically, but stigma wise, huge difference that I
Yep.
have seen in our communities, in the conversations we've had. So I agree, Indigo, labels and stigmas are real. But there are those of us who are working actively to stop that. And the more we can get people like Krystal, people like myself, like yourself, like Mary, like Pamela, like everybody we've got going on this channel, talking about it. First of all, talking about our own journeys helps us heal. It takes
Yeah.
the yuck out of the dark. And when you take it out of the dark, it just breaks down, right? And
Yes.
anyway, so I'm sorry for interrupting, Krystal. Yes.
No, that's okay. Um,
And I hate to do this actually, but I have another appointment in about 5 minutes. And
yes, we have been going.
we have been going, but this has been awesome.
It
Would you
has
be willing
been.
to continue on Thursday, this Thursday? Would that work for you?
Sure. Yep.
Okay. Okay. So we were
Why not?
supposed to have, we were booked anyways, but we were supposed to have a different person today. She was unavailable. Krystal so graciously agreed to fill in. And yeah, no, I think this is a good conversation to keep going.
Yes.
And for those of you in the chat right now, or those of you in the replay crew, thank you, first of all, for being here, both sets. And
Thank you very
bring
much.
your own stories, bring your own records of healing. If you feel that you have a story of healing that
Mhm.
you need to talk about and that will help other people, email me. I'm going to give you my email address. Okay,
Yep.
email me at myotherskeeper is at gmail.com. myotherskeeper is at gmail.com.
And if you have questions specifically for me, still send them there and Kim will get them to me.
I'll make sure she gets them right away. Yep.
Yes.
I do have a few people who have been in the chat today who have reached out, and I'm really grateful. Thank you very much. I will definitely be getting together with you very soon. And yeah, so Krystal, thank you, my girl. I love you.
Love you too.
Okay. I'll talk to you later, all right?
See you both. See you all on Thursday.
See you all on Thursday. Bye.
Bye.